The acid burned through Owen Zane's suit like tissue paper, leaving a network of sizzling wounds across his chest and abdomen. His scream echoed through the mining facility as he collapsed onto the metal grating, clutching desperately at the bubbling flesh beneath his tattered uniform. "Man down! We have a man down in Sector 7, shouted Morales, rushing to Owen's side. The rest of the excavation team scattered, abandoning their equipment as they fled from the ruptured pipeline that continued to spray corrosive industrial solvent in wild, unpredictable arcs. Owen's vision blurred as shock set in. The pain was overwhelming, shorting out his ability to think clearly. He was vaguely aware of being lifted, of voices shouting around him, but everything seemed distant and muffled. "Get him to medical, now," someone ordered. "And contact the Vrexian medical team on the orbital station. We don't have the facilities to handle this level of chemical burn down here." Time became meaningless as Owen drifted in and out of consciousness. He caught fragments of his journey being loaded onto a shuttle, the roar of engines, the cold sterility of an emergency transport pod. Pain medications dulled his senses, but couldn't completely erase the agony that radiated from his torso. When Owen finally regained full consciousness, he found himself lying on an examination table in an unfamiliar room. The ceiling was unusually high, and the light had a bluish tint that was different from the standard illumination used in human medical facilities. A steady beeping from nearby monitors provided the only sound. He tried to sit up but found himself restrained by some kind of transparent medical field that gently pressed him back down. "Please remain still," came a voice from his right. "Movement will aggravate your injuries." Owen turned his head to see a Vrexian physician approaching. The alien stood nearly 7 feet tall, with smooth gray-blue skin and 4 articulated arms. Its large eyes, 3 of them arranged in a triangle on its face, blinked independently as it studied the readouts on a floating holographic display. "Where am I?" Owen asked, his voice raspy. "You're in the xenological trauma ward of the Vrexian medical station," the alien replied. "I am Chief Surgeon Teklov. Your mining company has a medical contract with our facility for severe injuries that cannot be treated at your outpost." Owen tried to look down at his body, but couldn't see past the restraining field. "How bad is it?" Teklov made a gesture with his lower right hand that Owen had learned was the Vrexian equivalent of a grave nod. "The chemical compound that contacted your epidermal layer has caused extensive damage to approximately 27% of your integumentary system, with penetration into the underlying muscle tissue in several locations. The affected area extends from your upper thoracic region to your lower abdominal cavity." Owen swallowed hard. "Am I going to die?" "Not under my care," Teklov stated matter-of-factly, "though the recovery process will be substantial. We have already performed the initial debridement and neutralization procedures. The damaged tissue has been excised and the remaining chemical agents neutralized." The alien surgeon manipulated the holographic display, bringing up a 3-dimensional rendering of Owen's body with the injured areas highlighted in angry red. "We will begin a series of regenerative treatments tomorrow, once your system is stabilized." "How long will that take?" Owen asked. "When can I get back to work?" Teklov's 3 eyes blinked in sequence, a gesture Owen recognized as the Vrexian expression of cautious consideration. For a Vrexian with comparable injuries, the minimum recovery time would be 14 to 16 standard cycles, the surgeon explained. "Given the physiological differences between our species, and the limited data we have on human healing rates for injuries of this severity, I must estimate 21 to 25 cycles for you to achieve sufficient healing to return to normal activities." 3 weeks! Owen exclaimed, then winced as the movement sent a jolt of pain through his chest. "At minimum," Teklov confirmed, "and that assumes ideal healing conditions and no complications. I should note that we rarely treat humans with injuries of this magnitude, so I'm being conservative in my estimation." Owen closed his eyes, trying to process this information. 3 weeks in an alien medical facility, away from his team, away from his work. The mining company wouldn't hold his position for that long. They'd replace him, and he'd lose his end-of-contract bonus. "There must be something you can do to speed this up," he said. "Some advanced treatment?" "We are utilizing the most advanced medical technology in this sector," Tekloff replied. "Your recovery cannot be rushed beyond the biological limits of tissue regeneration. The damage is substantial, Owen Zane." The surgeon moved closer, his movements precise and deliberate. One of his lower hands adjusted a control on a nearby console, and the restraining field over Owen's chest became transparent, allowing him to see the extent of his injuries for the first time. What Owen saw made him gasp. His chest and abdomen were a mess of angry red tissue, with patches of synthetic skin covering the worst areas. Some sections were sealed with a clear medical gel that pulsed slightly with his heartbeat. "As you can see," Tekloff continued, "the damage extends beyond the superficial layer. Several of your abdominal muscle groups have been compromised, and there is minor damage to your liver that we have already repaired. The regenerative process must proceed in stages to ensure proper tissue formation." Owen let his head fall back against the examination table. "I understand," he said quietly. "Rest now," Tekloff said, adjusting a control that Owen assumed would deliver more pain medication. "We will begin the first regenerative treatment tomorrow. I will return to check on you in 6 hours." As the Vrexian surgeon moved away, Owen felt the medication beginning to take effect, dulling the pain and making his thoughts fuzzy. Before he drifted off, he made a silent promise to himself. He would heal faster than they expected. He had to. The next 3 days passed in a haze of treatments, examinations, and medicated sleep. Owen learned that the Vrexian medical approach was methodical to the point of being ritualistic. Every procedure followed a precise timeline, with Tekloff personally overseeing each step of the process. On the 4th day, Owen was awake and alert enough to have a proper conversation with his alien physician during the morning examination. "The initial tissue regeneration is proceeding at expected rates," Tekloff noted as he used a handheld scanner to assess Owen's wounds. "The synthetic dermal grafts have integrated well with your natural tissue." "That's good news," Owen said. "When can I start moving around? I'm going stir crazy just lying here." Tekloff's eyes blinked in that sequential pattern again. Mobility would be contraindicated at this stage. The new tissue is fragile and could tear if subjected to strain. Owen sighed. On Earth, doctors get patients up and moving pretty quickly after surgery. It helps prevent complications. "I am familiar with human medical protocols," Tekloff replied. "However, the extent of your injuries requires a more conservative approach. Perhaps in another 5 to 7 cycles, we can consider limited mobility exercises." Owen gritted his teeth but nodded. He had learned that arguing with Vrexian medical logic was futile. They followed their protocols without deviation. Later that day, a human nurse named Rachel came to check on him. She was one of the few human staff members at the facility, serving as a liaison between alien medical personnel and human patients. "How are you holding up?" she asked as she checked his vital signs. "Going out of my mind with boredom," Owen admitted. "And I'm worried about losing my job if I'm stuck here for 3 weeks. Rachel gave him a sympathetic look. The Vrexians are excellent surgeons, but they can be rigid in their approach. They apply the same recovery timelines to all species, adjusted only for body mass and metabolic rates. You're saying they might be overestimating how long I need to recover." She glanced toward the door before answering quietly. "Humans tend to heal faster than they expect. Our bodies are remarkably adaptive. It's one of the things that surprised the alien medical community when we first made contact. But they still base their treatment protocols on the most conservative estimates." Owen leaned forward slightly, wincing at the pull on his healing skin. "So what can I do to speed things up?" "I'm not advising you to go against medical orders," Rachel cautioned, "but I can bring you some protein supplements that might help with tissue regeneration, and maybe some light resistance bands for when you're alone, to keep your muscles from atrophying. Just Don't let Dr. Tekloff catch you using them yet." Owen smiled for the first time since the accident. "Thanks, Rachel. I appreciate it." "Just doing my job," she replied. "The faster you heal, the sooner we can free up a bed for someone else." True to her word, Rachel returned later with the supplements in a set of light resistance bands that she hid in the drawer beside his bed. "Start very gently," she warned, "and stop immediately if you feel any tearing sensation." Over the next few days, Owen followed a careful regimen. He took the supplements with each meal and performed gentle exercises when no Vrexian staff members were present. He started with simple movements, just enough to maintain mobility without straining his healing tissues. To his surprise, he began to notice a difference. The constant itch that accompanied the healing process seemed to intensify, which Rachel assured him was a good sign. The synthetic skin patches began to take on a more natural color, blending with his own skin tone. On the 8th day after his admission, Tekloff performed a more thorough examination using advanced imaging technology to assess the progress of Owen's recovery. "This is unexpected," the Vrexian surgeon said, studying the results. "The tissue regeneration has progressed approximately 30% faster than our models predicted." "That's good news, right?" Owen asked, trying to hide his satisfaction. "It is unusual," Tekloff replied. "The synthetic dermal layer has integrated completely, and the underlying muscle tissue shows significant healing. There are no signs of infection or rejection." The surgeon adjusted the holographic display, zooming in on specific areas. "I would like to perform additional tests to understand this accelerated healing response. It may provide valuable data for treating future human patients." "Does this mean I might get out of here sooner?" Owen pressed. Tekloff's upper hands made a gesture that Owen had learned indicated scientific curiosity. "It is possible. If this rate of healing continues, we may need to revise our projected recovery timeline. However, I must emphasize that rushing the healing process could lead to complications such as excessive scarring or reduced tissue elasticity." "I understand," Owen said, "but if everything looks good, there's no reason to keep me here longer than necessary, right?" "Medical protocols exist for good reason," Tekloff stated, "but they are not immutable. We will continue to monitor your progress and adjust the treatment plan accordingly." That evening, Rachel seemed pleased but not surprised by the news. "I've seen this before," she told him as she checked his vital signs. "Vrexian medicine is excellent, but they tend to underestimate human recovery rates. Our bodies evolved on a planet with countless pathogens and predators. We're built to heal quickly." "So you think I might get out of here sooner than 3 weeks?" "If you continue at this rate, maybe," she said. "But don't push yourself too hard. Those chemical burns were severe. I saw the initial reports when you were brought in. Everyone was surprised you survived at all." Owen nodded, sobered by the reminder of how close he'd come to death. "I just want to get back to work before they replace me. Mining contracts don't wait for injured workers." "Your health is more important than any contract," Rachel said firmly. "But I understand the concern. I'll talk to Dr. Tekloff about accelerating your physical therapy, now that the initial healing is going well." The next few days brought a modified treatment plan. Tekloff, intrigued by Owen's rapid healing, adjusted the regenerative treatments to complement the natural recovery process rather than imposing the standard Vrexian timeline. By the 12th day, Owen was permitted to sit up and even take short, supervised walks around the medical ward. His new skin was pink and tender, but intact, and the deeper tissue damage showed remarkable improvement. "Your species continues to fascinate me," Tekloff remarked during one examination. "The cellular regeneration rate exceeds our reference data by a significant margin. I would be interested in collecting tissue samples for further study, with your consent." "If it helps other patients, sure," Owen agreed. "But does this mean I'm ahead of schedule?" "Significantly," the surgeon confirmed. "Based on current progress, you may be capable of returning to light duty in another 5 to 7 cycles, rather than the 14 I initially projected." Owen tried not to show his disappointment. Even the revised timeline would mean nearly 3 weeks of recovery. That's good to hear, he said with forced optimism. That night, after the medical staff had completed their rounds, Owen carefully inspected his healing wounds in the privacy of his room. The synthetic skin had fully integrated with his natural tissue, leaving only faint lines where the seams had been. The deeper wounds were still tender, but the pain had diminished to a manageable ache. He performed his secret exercise routine with slightly more intensity than before, testing his limits cautiously. To his satisfaction, he was able to complete a series of gentle stretches and light resistance exercises without any sharp pain or sense of tearing. "You're pushing it," Rachel observed when she entered his room unexpectedly, catching him mid-exercise. Owen quickly lowered his arms. "Just following your advice." She shook her head but smiled. "At least your color's better. The supplements seem to be working." She checked the monitoring equipment and made notes on her tablet. "How's the pain level? And be honest, I can see your readings." 3 out of 10, Owen replied. "Manageable without medication now except at night." Rachel nodded approvingly. "That's significant progress. Most patients with your level of injury would still be on continuous pain management." She lowered her voice. "Listen, I've been reviewing your case with some of my human medical colleagues. Your healing rate is impressive even by human standards. Were you in any kind of enhanced physical training before the accident?" Owen shrugged. "Just the standard company fitness program for mining operations. Nothing special." "Well, something's working in your favor," she said. "I'm going to suggest to Dr. Teklov that we move you to outpatient status sooner rather than later. The beds here are needed for critical cases, and you might recover better in a more normal environment." "That would be great," Owen said eagerly. "I feel like I'm ready to get out of here." Rachel gave him a stern look. "Don't get too excited. Outpatient status doesn't mean back to work. It means transitioning to a recovery facility where you'll continue therapy, but with less direct medical supervision." "Still better than being stuck in this room," Owen pointed out. "True," she conceded. "I'll speak with the doctor tomorrow." As promised, Rachel advocated for Owen's case during the morning rounds. Teklov was initially resistant, citing the need for continued monitoring of the healing tissues, but eventually agreed to conduct a comprehensive assessment to determine if Owen was ready for transfer to a less intensive care setting. The evaluation was thorough. Owen was subjected to a battery of tests, including stress analyses of his healing tissues, metabolic assessments, and even psychological evaluations to determine his readiness to manage his own care. To Teklov's evident surprise, Owen passed all the benchmarks. "These results are unprecedented in our experience with human patients," the surgeon admitted, reviewing the data with a mixture of professional curiosity and what Owen interpreted as mild disbelief. "The tissue integrity is approaching 90% of normal parameters, and your pain response indicates that the neural pathways have successfully reintegrated." "So I can be discharged to outpatient care?" Owen asked hopefully. Teklov made that sequential blinking gesture again. "According to our protocols, you have met the criteria. However, I must emphasize that you are still healing. Any strenuous activity could reverse the progress you have made." "I understand," Owen assured him. "I'll follow all the recovery guidelines." "Very well," Teklov said after a moment's consideration. "I will authorize your transfer to the Human Recovery Ward on Deck 5. You will continue daily treatments there, but with reduced medical supervision. Any sign of complication, however, will result in immediate readmission to this unit." Owen could hardly believe his luck. After just 14 days, half the time Teklov had initially estimated, he was being moved to outpatient status. It wasn't the same as being cleared for work, but it was a significant step toward regaining his independence. The Human Recovery Ward was a revelation after the sterile, regimented environment of the Vrexian medical unit. Located on a deck specifically designed for human patients, it had standard Earth gravity, more familiar lighting, and even windows that looked out into space. Owen was assigned a private room that felt more like a small apartment than a hospital space. It had a proper bed instead of a medical examination table, a small sitting area, and an attached bathroom with shower facilities adapted for patients with limited mobility. Rachel helped him get settled, explaining the outpatient protocols. You'll have a daily check-in with medical staff, and 3 times a week, you'll return to Dr. Teklov's unit for advanced regenerative treatments. The rest of the time, you're responsible for following your care plan. Which includes what exactly? Owen asked. Regular application of the healing gel, she said, indicating a supply of medical containers on the counter. Light exercise according to the schedule. She handed him a tablet with a detailed therapy program. And proper nutrition. She gestured to the food preparation unit in the corner. The system is programmed with meals designed to support tissue regeneration. Owen took the tablet, scanning the exercise regimen. It was more substantial than his secret routine had been, but still conservative by his standards. This seems manageable. The key is consistency, Rachel emphasized, and honesty about your progress. If something hurts or doesn't feel right, report it immediately. Don't try to push through pain, that's how complications develop. Got it, Owen said. When will I see Dr. Teklov again? Day after tomorrow for your first outpatient regenerative treatment. In the meantime, the human medical team will check on you daily. She paused at the door. This is a big step, Owen. Don't ruin it by trying to do too much too soon. After Rachel left, Owen took a proper shower for the first time since the accident, carefully keeping the healing skin protected with a special covering. The feeling of hot water on his body was almost overwhelming after 2 weeks of sponge baths. Later, as he lay in his new bed, infinitely more comfortable than the examination table, Owen considered his situation. He was healing much faster than expected, but still not fast enough to save his job if the company decided to replace him. He needed to accelerate his recovery even more. The next morning, Owen began implementing his plan. He followed the prescribed exercise routine, but added additional repetitions when he felt capable. He doubled the protein content in his meals, programming the food unit to increase the nutritional density. He applied the healing gel more frequently than directed, reasoning that if some was good, more might be better. The human medical staff who checked on him seemed impressed with his progress, but warned him not to overdo things. Owen assured them he was following the plan exactly, hiding the evidence of his enhanced routine. By the time he returned to Teklov's unit for his first outpatient treatment, the difference was noticeable. The Vrexian surgeon spent an unusually long time examining Owen's healing tissues, his 3 eyes blinking rapidly in what Owen had learned indicated surprise or confusion. This level of tissue regeneration is abnormal, Teklov stated finally. The new dermal layer is showing elasticity and vascular integration that should not be possible in this time frame. Owen tried to look appropriately mystified. Is that a problem? It is. Unprecedented, the surgeon replied. I have consulted our database of human medical cases, and there's no record of burn recovery proceeding at this rate, even with our advanced treatments. He adjusted the scanner, focusing on a particular area of Owen's abdomen. The muscle tissue here has almost completely regenerated. This should have taken at least another week. Maybe I'm just a fast healer, Owen suggested. Perhaps, Teklov conceded, though he sounded unconvinced. Or perhaps there is something unique about your particular physiology that we do not understand. He set aside the scanner. I would like to conduct some additional tests, with your permission. Blood samples, tissue biopsies, nothing invasive, but enough to help us understand this accelerated healing response. Owen hesitated, worried that more tests might reveal his self-administered enhanced recovery program. Is that really necessary? If I'm healing well, isn't that what matters? From a treatment perspective, yes, Teklov acknowledged, but from a scientific standpoint, your case represents a valuable opportunity to advance our understanding of human physiology. This knowledge could benefit future patients. Put that way, Owen found it hard to refuse. All right, but nothing that will slow down my recovery. Of course not, the surgeon assured him. These will be minimally invasive procedures that can be performed during your regular treatment sessions. Over the next few days, Owen continued his enhanced recovery program while submitting to Teklov's additional tests. The Vrexian surgeon became increasingly fascinated with Owen's case, often bringing in colleagues to observe the healing tissues and discuss theories about the accelerated recovery. By the 18th day, after his admission just over 2 weeks since the accident, Owen felt almost completely healed. The new skin on his chest and abdomen was slightly paler than his natural coloration, but otherwise normal. The deeper tissues had fully regenerated, and he no longer experienced pain during his now quite rigorous exercise routine. During his scheduled treatment session, Owen decided to push for full clearance. "Dr. Teklov," he began as the surgeon examined his latest test results, "I think I'm ready to return to work." The Vrexian's eyes all focused on Owen simultaneously, a sign of intense attention. That would be contrary to all established medical protocols. Even with your exceptional healing rate, a return to full activity at this stage would present significant risks. "But your own scans show that the tissues have regenerated," Owen pointed out. "I'm not experiencing pain. I have full range of motion, and my strength has returned. What medical reason is there to keep me sidelined?" Teklov seemed to consider this question carefully. "The new tissues, while functional, have not yet achieved full maturation. The risk of re-injury is still elevated, and there are aspects of your recovery that we do not fully understand, which suggests caution is warranted." Owen leaned forward. "Doctor, I appreciate your concern, but I'm going to lose my mining contract if I don't return soon. The company has already warned me that they'll have to replace me if I'm not back within 3 weeks of the accident. That deadline is approaching fast." The surgeon was silent for a moment, his 4 hands moving in complex patterns that Owen recognized as a sign of deep thought. "I cannot in good conscience provide full medical clearance yet," he said finally. "However," Owen perked up at that, "however. I could authorize a limited return to duty, with specific restrictions on the activities you may perform," Teklov continued. "No exposure to hazardous materials, no heavy lifting, and mandatory daily medical checks for the first week." "I can work with those restrictions," Owen said quickly. "Most of what I do now is supervisory anyway." Teklov's upper hands made a gesture of reluctant agreement. "Very well, I will prepare the necessary documentation, but I must insist on continued monitoring. You will return to this facility every 3 days for a comprehensive evaluation." "Agreed," Owen said, trying not to sound too eager. "And you must provide daily updates via the medical monitoring system we will install on your personal device," the surgeon added. "Of course," Owen assured him. "This is highly irregular," Teklov noted. "In 27 years of medical practice, I have never released a patient with injuries as severe as yours in such a short time frame." "I appreciate your flexibility," Owen said sincerely, "and all the care you've provided. I wouldn't be alive without your skill." The Vrexian acknowledged this with a gesture that Owen interpreted as modest acceptance. "Your species continues to surprise me," Teklov admitted. "Perhaps our medical protocols for humans require revision based on cases like yours." 2 days later, Owen stood at the shuttle dock, ready to return to the mining outpost. Rachel had come to see him off, her expression a mixture of professional approval and personal concern. "Dr. Teklov is still talking about your case to anyone who will listen," she told him. "You've become something of a legend in the xenological medical community, the human who healed in half the expected time." Owen smiled. "Just lucky, I guess." Rachel gave him a knowing look. "Luck, determination, and probably some rule bending that I don't want to know about." She handed him a small medical kit. "Extra healing gel and supplements. Follow the restrictions Dr. Teklov outlined. They're there for a reason." "I will," Owen promised. "Thanks for everything, Rachel. I wouldn't have made it through this without your help." "Just doing my job," she replied with a smile. "Stay safe down there. No more acid baths, okay?" "Definitely not on my agenda," Owen assured her. As the shuttle departed from the medical station, Owen looked back at the massive orbital facility growing smaller through the viewport. 3 weeks ago, he'd arrived there barely clinging to life, his body ravaged by chemical burns that should have killed him. Now he was returning to work, healed and whole, defying all medical expectations. The mining outpost came into view, a sprawling industrial complex clinging to the surface of the moon they were harvesting for rare minerals. Owen felt a surge of anticipation. He'd made it back in time to save his contract. More importantly, he'd proven something about human resilience that had impressed even the Vrexians with their advanced medical knowledge. When the shuttle docked at the outpost's main terminal, Owen was surprised to find a welcoming committee waiting for him. Morales, who had been the first to reach him after the accident, stepped forward with a broad grin. "They said you'd be laid up for a month," Morales exclaimed, clapping Owen carefully on the shoulder. "How the hell are you back already?" Owen returned the smile. "Turns out humans heal pretty quickly." "Quick enough to make alien doctors scratch their heads from what I hear," said Singh, the outpost's chief engineer. "The company's been getting daily updates from the medical station. Word is that you've set some kind of recovery record." "Just wanted to get back to work," Owen said modestly. "Well, your timing is perfect," Singh continued. "We're about to move into a new section that has some of the highest concentrations of neodymium we've seen on this rock. Your team has been keeping your spot warm." Owen felt a wave of relief wash over him. "So I still have a job." "Are you kidding?" Morales laughed. "After what happened, the company's treating you like some kind of public relations gold mine. Human resilience in the face of industrial hazards or some corporate nonsense. They're even using your recovery to negotiate better terms with the Vrexian Medical Consortium." As they walked toward the residential section of the outpost, Owen found himself reflecting on the experience. The accident had nearly killed him, and the recovery had been challenging, but he'd pushed through it faster than anyone thought possible. There was something satisfying about that, about exceeding expectations and defying the limitations others placed on him. When they reached his quarters, Owen found them exactly as he had left them before the accident, right down to the half-finished report on his personal tablet. "Get some rest," Singh advised. "You're on light duty for the next week per the doctor's orders. Morning briefing is at 0700. After his colleagues left, Owen sat on the edge of his bed, running his hand over the new skin on his abdomen. It was smoother than his original skin, with a slightly different texture, but fully functional. In time, even the color difference would fade. His personal device pinged with an incoming message. Opening it, he found a final note from Dr. Teklov. "Owen Zane. Your recovery has provided valuable data that will benefit future human patients under our care. I have initiated a research study based on your case with the goal of developing more effective treatment protocols for human-specific injuries. While I still maintain that your return to work is premature by Vrexian medical standards, I acknowledge that human physiology appears to operate under different parameters than our models predicted. Your species' adaptability continues to be a subject of fascination in xenobiological circles. Maintain your monitoring schedule as agreed. Any sign of complications should be reported immediately. May your recovery continue favorably, Chief Surgeon Teklov." Owen smiled as he set the device aside. He had beaten the odds, defied medical expectations, and returned to his life in just over half the time the alien surgeon had predicted. Tomorrow, he would step back into his role as a team leader with a new appreciation for human resilience and the advanced medical care that had saved his life. As he prepared for bed, Owen made a mental note to send a proper thank you gift to both Teklov and Rachel. After all, it wasn't every day that you survived what should have been a fatal accident and recovered in record time, even if you had to bend a few rules along the way. With a satisfied sigh, he settled into his familiar bed. The constant ache of healing tissues was still there, a reminder of how close he had come to death, but it was manageable. He had survived, recovered, and returned faster than anyone thought possible. Tomorrow would bring new challenges, but for now, he had won his personal battle against time and injury. And somewhere on the orbital medical station, an alien surgeon was still puzzling over the human who had healed in days when it should have taken weeks, a medical mystery that would ultimately benefit countless future patients. That, Owen decided as he drifted off to sleep, might be the most satisfying outcome of all.